Welcome to the Healthy Waterloo Initiative, creating Canada's healthiest campus by achieving collective impact. My name is Donna Reams, and I am honored to be moderating this conversation today. To begin our time together, I want to acknowledge that we live and work on the territory of the neutral Anishinaabe and Haudenosaunee peoples. The University of Waterloo is situated on the Haldimand Tract, the territory granted to the Six Nations that includes 6 miles on each side of the Grand River. As we grow the Healthy Waterloo Initiative, we remember that well-being includes truth, reconciliation, and repair. We commit to fostering health in ways that honor the land, its original caretakers, and our shared responsibility to one another. For our session today, Steve is going to start us off with a quick overview of the Healthy Waterloo Initiative and provide us with some insight into the work that's been happening so far. Then Paul is going to walk us through what collective impact means and why we are using this approach for HWI, because we love our acronyms. We are recording today's session, and the plan is to offer more webinars like this to keep our campus community updated and involved. All updates will be posted online, and we're currently working on a dedicated home for that content, so we will loop everyone back in when it exists. We will have time for questions at the end of the session today, so please drop them in the Q&A throughout the session. You can find the Q&A just on the top barcode at the top of your screen. So I am very excited to introduce our two speakers. First, we have Dr. Stephen Fisher. He is the Executive Director of CC Care and an Associate Professor here at the University of Waterloo. Through CC Care, which stands for the Center for Community, Clinical, and Applied Research Excellence at the University of Waterloo, he leads a team that blends research, work-integrated learning, and evidence-based programming to transform health and wellness in our communities through exercise. Steve's work bridges science, practice, and community partnership to create evidence-informed solutions that promote health where people learn, work, and live. And we are also very fortunate to have Steve co-spearheading the Healthy Waterloo Initiative. Second, I would like to introduce Paul Bourne. He is the co-founder of the Tamarack Institute and a community change strategist. He is a University of Waterloo alumni, best-selling author, and internationally recognized leader in community innovation and large-scale change. As the co-founder and former CEO of the Tamarack Institute, he has helped thousands of leaders across Canada and beyond build vibrant communities through collective impact, collaboration, and place-based strategies. Paul was appointed to the Order of Canada in 2019 and has received the 2020 Arts Alumni Achievement Award from the University of Waterloo. Paul is renowned for making complex ideas of social change accessible and actionable. He brings decades of experience guiding communities to work together for population-level impact. I am very excited to have these two speakers here with us today and for all of you to get a glimpse into the great work that's been happening. Personally, I am very inspired by the potential of what this initiative means and the opportunity for us to come together as a campus and truly support the well-being of our campus community. I hope today's session not only builds awareness, but also sparks excitement about what's possible as we work towards becoming Canada's healthiest campus. So with that, I'm going to hand things over to Steve.
Excellent. Donna, thank you so much for those introductions. And Paul, thank you for joining us and for all of your support for Healthy Waterloo so far. Really excited to have an opportunity to spend some time with all of you today and talk about what Healthy Waterloo Initiative is, where we hope to go, and then turn it over to Paul to help us understand a little bit more about collective impact and why that we think will be such a useful and potent tool to help us move this initiative forward. So I'll take maybe 10, 12 minutes and kind of walk us through Healthy Waterloo Initiative as we're forming here, and then hand over to Paul, and he'll really help to fill in some of our understanding in terms of collective impact, why it's useful, how it's working, and why we've tied Healthy Waterloo to a collective impact approach. So I'll dive in here. Like Donna mentioned, our goal is a little bit audacious. We'd like to create Canada's healthiest campus. Now, when we say create Canada's healthiest campus, this isn't in the competitive sense of, we want to be better than everybody else. we want to be healthier tomorrow than we are today for ourselves. We want to be healthier the day after that than we were the day before that. So we want to continually work to reimagine how we think about health on campus, in our community, and beyond. And today is really the seed of that. And with Paul's support and guidance and leadership and engagement of all of you, we hope to propel that forward. And really what we hope at the end of the day comes out of this is we've kind of reimagined healthcare, at least from the preventative space. So as you can see in the text, imagine that, for many of us, we think of health starting when we get to the doctor's office or we get to the hospital door. Imagine that health starts in our communities. Imagine that health starts in our classrooms. Imagine that health starts in all the places where we work, live, and play. What might the system look like that supports that behavior, that supports that feeling? And that's ultimately where we're trying to get to through Healthy Waterloo. So just join me for a second and imagine. Imagine that everyone feels seen, supported, and healthy on campus in our communities. Imagine that we have equity and well-being. They're embedded in everything we do, all of our work, all of our learning. Imagine that the University of Waterloo is a living lab where we're co-creating and validating real-world products and ideas that can help shape health in real time. A quick tangent on that, we think about for students and staff and faculty and some of the benefits programming we have, imagine if benefits companies come up with new ideas, new innovative ways to support our health and well-being. Could we try them? Do we have systems that allow us to try them? Do we have systems that allow us to learn what those might look like and how they might positively impact our health? Can we learn what some of the consequences might be and can we mitigate those if necessary? Linking back to innovation here at the University of Waterloo, imagine if health innovations developed and tested here scaled across Canada, scaled around the globe. Imagine if this was the starting place for a new way of thinking about preventative health, both on campus and around the globe. But most importantly, imagine if working and studying at Waterloo is good for all of our health. That's what we hope to achieve through the Healthy Waterloo initiative. So who are we? For many of you, you will look at some of those words on the screen and quickly recognize that these are the university values. We work together, we think differently, we act with purpose. So this underpins everything we're doing with Healthy Waterloo, united around our university values. When we think about working together, well, how are we going to do that? I'm going to talk a little bit about that in terms of collective impact and shortly turn it over to Paul to teach us much more about what this means and how we engage and how we work together through a collective impact strategy to have broad, wide-scale change and impact. We're designed to think differently at Waterloo, which really excites me about the potential for success that we can have here with the Healthy Waterloo initiative. And again, part of thinking differently is reimagining our roles in part on campus as students, as faculty members, as staff, as alumni, and thinking about what is our role to help support innovation in terms of helping to try ideas, helping to test ideas, helping to iterate, helping to learn, how do different policies shape our health? Can we try some new initiatives? Can we try some new ideas? There are already a number of places on campus where this is happening and moving quite well. Can we scale this and really expand how we're testing ideas, learning, particularly around health and preventative health on campus? And lastly, we're acting with purpose. We wouldn't be here today without the vision of the Waterloo at 100 strategic framework and the Global Futures strategy and plan ahead. This really, ignited conversations around what can we do, particularly around health, but also with a number of the other futures. What can we do to really move the needle? How can we make sure that when Waterloo turns 100, we've had a massive impact on the health and well-being, not only on campus, but across our country and perhaps around the globe. So that acting with purpose, again, remains really important for the Healthy Waterloo initiative. So Paul's going to talk in much more detail about collective impact, but I wanted to anchor us on a few key ideas here. And you see a little circle, and you might see variants of this in Paul's presentation as well. But we think of collaborative leadership. And Donna mentioned, we've done a lot of work to date. And to date, we've worked really hard to develop a formation team representing the university. So we have folks that represent the interests of students, staff, faculty, but also the community and business leaders in the community and developers in the community as we continue to reach out, alumni in the community, and continue to bring these folks together to help us sort of shape and build out that community plan going forward. How will we have this impact? How will we become Canada's healthiest campus? And again, Paul's going to fill in some details today on more around what this collaborative leadership looks like. We'll have some backbone infrastructure, and again, Paul will speak to this. So we're working hard. We've already have some funders that have been very gracious in supporting, seeding this initiative to help us get off the ground. We continue to work hard to generate more support for the initiative. No shortage of folks very interested and passionate about rethinking how we manage, how we handle health, and very excited to see that the University of Waterloo is diving into this. Community engagement. This is a great example. How do we continue to engage all of our community in a conversation of health? How do we continue to share feedback around all of the great things that are already happening and that will continue to happen in the future? How do we support community innovation? This ties back to that living lab concept, and we have organizations here like Velocity and others that are world leading in our ability to scale ideas to commercial products, to go to market strategies, thinking about product market fit. And all of these matter in the context of health, but also we have lots of great researchers and supports in terms of how we do this at a policy level. How can we reshape or rethink or transform policies that in some cases constrain how we behave as individuals and what that might mean for our health? And lastly, evaluating impact. University of Waterloo has a great reputation for computer science, data analytics, among others. It's no surprise that we have a lot of rich information right here on campus. So we continue to work with IIP and others to integrate some of that information and to really help us learn as a community, what is our current health in broad strokes, and how can we continue to improve that? So we're really excited to sort of continue pushing these forward. So just a couple concluding thoughts here. We are starting today, this is kind of the seedling of an idea. We're planting a tree, so to speak, and really excited to have this conversation and have all of you join this call as we plant this tree and water it and begin to fertilize this tree. But ultimately, we want this to grow. Again, we want to be Canada's healthiest campus, but we don't want to stop there. Many of us are in lots of conversations around the impact of having a hospital right here on campus. Well, imagine, by the time that hospital's up and running, we also have an aligned Center for Community Health Innovation. Perhaps in the future we can have a contest around the name, but imagine what that might look like. Imagine where health doesn't start at the hospital door, but perhaps it's happening in our community. And when we need the hospital, it's certainly there, but we have a much more symbiotic partnership in terms of how we're supporting health in our communities on campus more broadly, that's linked to the hospital system, but maybe isn't driven by a hospital first approach that many of us often think about. Just as we finish up here, where are we briefly and how will we work together? Currently, we've been developing a formation team, and our formation team's continuing to reach out broadly around campus. We want to hear from all of you. We want to understand, what do you do to protect your health? What are the 5 top things you might do to protect your health? What prevents you from doing those as often as you'd like, for example? We'd love to have more conversations just like that. Currently, we're starting to pull together information, like I mentioned, that we already have on campus, understanding what assets we have on campus, looking to see are there bright spots, what are other organizations doing, other universities across Canada, around the globe. So we're continuing to sort of make sense of sort of the current state of our situation and the current state of health on various campuses. As we move into the winter and spring, really as we're learning and having more conversations with all of you, building out a community plan, and Paul will probably talk a little bit about this when I turn over the reins here in a moment. Continuing to have more conversations, understanding, what do we want to do? What does it mean to be Canada's healthiest campus? What does that mean we have to achieve? What are the sort of strategic pillars we need to focus on? So that's the work that's going to be happening over the next 6 to 8 months as we bring folks together and really understand what our system looks like and where in that system we might want to start affecting change. As we move in, over the next year or so, we hope to be in a position where we've have a plan that's laid out. We have some strategic objectives. We're starting to align in some working groups to move forward and to advance different agenda. And perhaps these are supported through, catalyst grants. Maybe we have some ideas that we want to mobilize and we need some resources to do that. Engaging our students and looking at things like capstone challenges and pitch competitions. How can we continue to engage students as learners while also supporting our entire campus community, students, faculty, staff, from a health perspective? What might that look like? So in a year or so, hopefully we've tapped into some of the existing structures, the iCapstone program that was just funded under a recent Global Futures network application as well. So continuing to tap into the existing growing resources that we have here. And then obviously continuing forward, this won't be a one and done initiative. This is going to take some time, and I think Paul's going to help us understand both what that time horizon might look like and why it's really important to allow us to have all of these really important and useful conversations. So just as I wrap up, 2 quick notes. If you happen to have your smartphone, you can take a quick image of the QR code. That will take you to AI generated podcast that is a nice summary of some of the conversations that we've already had as a formation team in building out this idea. So I do acknowledge that it's AI generated, but it's all informed based on our own content. And it's a really kind of nice engaging way if you happen to be out for a stroll with the dog or whatever else, a nice way to kind of listen in. We are continuing to grow in terms of social media presence. We have a web presence that will be coming online shortly. We're a few weeks ahead of that, but that doesn't stop you from getting engaged now. So if you'd like to learn more, absolutely send an email to healthy.waterloo@uwaterloo.ca. We'd love to get in connection with you and have a conversation and learn more about your perspectives on how you feel Healthy Waterloo could move forward. So with that, working and studying at Waterloo should be good for our health. I hope you'll join me in making that so. With that, Paul, I'll turn it over to you.
Thanks so much, Steve. Really appreciate that presentation. And thanks, Donna, as well for your great introduction. Really appreciate that. I'm just going to open up a screen here and just making sure. I think are we on full screen there?
Yes, we are, Paul.
Lovely. Okay. Well, first of all, it's wonderful to have you here. I've already thanked Steve and Donna, but Russ and Lily have also been really important at the Faculty of Health, and the whole faculty itself has been behind this initiative and is the sponsor. The formation team is from across campus and some community members, and that's also really important as we build out this multi-sector network of people that care about a healthy Waterloo. When we talk about this initiative, and Steve did such a great job introducing it, at the heart of it is that it's going to require some large-scale change. Now, that's interesting because you can say, well, aren't we already quite healthy? And actually, the data is showing that in many ways, in comparison to other universities, we're doing okay. Can we do better? Of course. Are we the best? Of course not, right? So what does this all mean? And then how do we actually start to think about this as a population level outcome? And how do you get population level outcomes on campus? But what about the 30,000 students that live off campus, right? And all the faculty and staff that live off campus. So there's an interrelation between what happens at the university and what happens in the community. So this is interesting. And so the challenge for us is to try and figure out how we move the needle on health. This is a lifelong desire and hope for almost all social change, is how do we actually create the kind of change that makes things better for everyone? Steve talked a little bit about thinking differently, and of course, that's what we're known for as a university. We're Canada's innovation university. Well, what does it mean in this context? Well, first of all, it means that we are trying to understand what are the system dynamics that are affecting the health of students, of faculty, of staff, of the broader community? And what are the interrelationships between those system dynamics? We also want to heighten like just our ability to think creatively. It's interesting, right? Because at our formation team, everyone there has an answer. If we go more broadly onto campus, everyone has an answer and, in a sense, a solution, right? What do we need to do to become healthier? But what we've done, instead of looking at those answers and debating them and trying to understand which is the best one, our first attempt is to move toward asking questions. We want to sort of let go of those mental models that help us understand health the way that it is and begin to look for opportunities for broader thinking, maybe innovative thinking, because of course innovation is technical. So we're looking for technical solutions, yes. It's also social, right? The interconnections between people. It's also political, right? In terms of the systems that are in place and the systems that sort of have the power to control. And so we're looking at how do we begin to enter those and find solutions. Lastly, we're beginning to open ourselves to a more intense form of collaboration. We're calling that collective impact, and we'll talk about that. Collective impact is really a combination of many ideas, but it is what we consider today the highest level of understanding of collaboration that leads to impact. But let's start with the issue. So health is a very complex issue. I have a favorite note where someone might ask, what's 2 plus 2? Of course, the easy answer is 4. But I loved it when an innovator said, well, it depends, because a lot can happen during the plus. And it's interesting because when you take all the things that the University of Waterloo has going for it in terms of its health, the health of the people that are there, the system that creates health, oh boy, if we added all that up, we could say, how could we not be healthy? But when we start to look at the plus, so you're adding them and adding them and adding them, and you wonder where is the interrelation and the correlation between them? And why is it that when we add them all up, right, there are so many holes that people fall through? There are so many things that don't create an exponential outcome. So it's kind of an interesting question overall. So health itself is a complex issue. It's difficult to frame. There's a ton of interconnected root causes, and these require form of interconnected responses. So it's not just, someone is feeling down, go for counseling. It's not that simple. They could be feeling down because they're not eating well, they're not exercising well, that there are social relationships in their lives that are causing that. So just one solution isn't going to solve the problem. And there are therefore many stakeholders that need to act at the same time. We can call them stakeholders. I prefer to say there are many people who care about your health that need to act at the same time. And we need to bring these people who care about health into the room and have a conversation and ask them bigger questions. The strangest thing about health is that it's dynamic, it's adaptive. So we solve one part of our well-being and another one surfaces. And so sometimes because we solve one, another health issue arises. And so our health is constantly adapting. Our health is dynamic. And system health is even more dynamic and it's even adapting at a faster pace. And lastly, health is somewhat unique to local context. health at the University of Waterloo is probably somewhat different than at Wilfrid Laurier. It's certainly different than at UBC. So you're asking yourself, what are the issues that are unique to the local context, that are unique to the local community? And how do we engage in those and understand those? So with collective impact, we're working at maybe a higher or broader level. We need to challenge our mental models. We need to challenge the relationships and connections between ideas and services. And of course, we need to challenge the power dynamics that keep things the way that they are. Sometimes those are the most challenging ones to address, but not if we involve them and involve everyone collectively. So, how do we do this? How can collective efforts achieve an impact? Well, first of all, this is the stage that we're at. And that is that we are uniting the people who care. We're growing community awareness. So we're just at the very early days. That's why this webinar, that's why we have students out asking other students about their health journey. Soon we'll be asking staff and faculty the same question. But mainly it's to build awareness. But why do we build awareness? Because we want to create a common will. They say, you know, most of the big problems today is not about money. It's not even about ideas. It's actually about the will to do them. And so the creation of that will, that uniting of a large group of people toward a common effort is what we call in collective impact the common agenda. The common agenda is, in some senses, the strategic plan, yes. But more importantly, it's a large group of people, a multi-sector group of people, both in the community and on campus, that want to do something to improve the well-being and health of the whole. We soon start to look at systems change. So right now we're asking, for instance, students and soon staff and faculty, what are the 5 top things you do to stay healthy? We also ask, what are some of the barriers for you to stay healthy? Maybe your top 5. But then we're going to start bringing people into small groups. And in those small groups, we want to have discussions about what is happening on campus that is causing you, that is making it difficult to be unhealthy. What's happening that's making it difficult to be unhealthy? And or we're asking the question, what are the systems, what are the programs, the ideas that are causing, that are making it easier, right? Russ Toppling talks about the means and the motivation, right? In order for us to make it easier for people to do the right thing. What are the means and the motivation for helping them do that? And then we ask what's available and what are the approaches, what's the culture for health at the university and outside the university? It's an interesting question. And how do we begin to understand those and shape them? And then how do we bring the people who control those systems and policies into the conversation so that they're willingly adjusting those, investing in those in order for changes to occur? So yes, on the one level, it is about individuals taking responsibility for their well-being and health and them feeling motivated and excited to do that. On the other hand, it also is about engaging system players to help understand how what they're doing affects health. And how do we begin to change those mental models? How do we begin to change the policies that help us understand that with these adjustments, we could have significant better outcomes? That's the hope. From there, we're going to be developing a large-scale plan. And this large-scale plan, it's a multi-year, probably 5 years, and we're looking to align both our ideas, our strategies, and the programs that we're going to be recommending with the kind of systems change that we're hoping for. And so this plan brings together many sectors, not just university level, also community level, also government level, and also business level. All need to be working together with what we call people with lived and living experience. So in all of our leadership structures, we have people with lived and living experience of health and well-being at the University of Waterloo, students, faculty, and staff. And why is that? Because we're not just looking for the experts to bring ideas. We're looking for everyday people to help shape the future that they want. And ultimately, we want to start tracking the population level outcomes. And the hope is that those outcomes are really operating at three levels. We're trying to understand, first of all, how are real people doing better? Number two, we want to understand how we are applying what we're learning. So it's not just good enough here to learn about what's needed, to learn about what the problem is, but we need to apply that to new solutions. And that those new solutions need to become part of a collective effort to become better at what we do. And lastly, our learning needs to be applied to systems change. So when people are doing things that are making them healthier, when we're learning and understanding, and we start applying that, then system change leaders begin to make the changes, and we can then tabulate how people are doing better, how the system is improving, and how our learning will has the possibility of better outcomes, not only now, but into the future. And that's something we want to talk about a little later on. Essentially, the collaborative premise is this. If you bring the appropriate people together in constructive ways with good information, right, they will create authentic visions and strategies for addressing the shared concerns of the organizations in the community. That's the hope, that we can actually bring the right people together, provide the right information, help them develop an authentic common vision. We're working at this now by actually bringing together what we call, or first of all, identifying, and then in March, bringing together what we call our top 100. Our top 100 will be a selection of people who care about this work. They will come from the university, they will come from government, they will come from business, they will come from the community sector, and they will come with people with lived and living experience of health, the people who we most want to have better lives. And we're going to be in a dynamic, large conversation by providing them with some very important information. First of all, health data. What's the data that helps us understand health at the University of Waterloo? And more importantly, what's the data in comparison to others, to other universities and other communities? This helps us begin to understand what we mean by health outcomes, and it helps to measure ourselves in a variety of ways. Secondly, we want to provide them the information about the assets that the university and the community has available to it, and they are vast. The health assets are far beyond the hospital, but yet we have a hospital coming, right? Even on campus, which is just remarkable when you think about it. But when you think about all the different ways that we work at health, it's like almost an endless number of initiatives. And then you add what's all available in the community. So we want to do an asset map that provides this kind of information to this top 100. and to the broader community, of course. And lastly, we're beginning to look globally. Who are the universities, who are the communities that have done this kind of work before? And or maybe not exactly what we're doing, but enough so that we can start to learn about what are the things that have most caused them to be successful. So this is our starting point and our hope. Collective impact itself is a it's a technique. It's something that I've been writing about, and the Tamarack Institute has been writing back, and I published my first book on it in 2010 called Community Conversations. And then in 2010 as well, Barack Obama and Michelle, they put together a White House Council on Community Change led by Melody Barnes. We became very attached to them at the Tamarack Institute and became sort of the primary source of disseminating their learning into Canada. In 2011, there was a paper by John Kanya and Mark Kramer that was published by the Stanford Social Innovation Review. And to date, it's still the #1 ever downloaded paper at that university. And it began to describe the work that organizations like ours were doing, trying to understand what they were doing differently and how they were having large scale population level outcomes, or at least they were trying to. This was very important to the White House because on the one hand, they wanted not only the tools for communities to do better on their own, but they wanted to better understand how we can get communities to actually change the population outcomes around key issues, specific or most importantly for youth. So this was an interesting kind of point that they looked at. So here is what, matter of fact, sorry, at the end, the White House did share that one of two things that every community in the United States should be looking at and should have the means to adopt was a collective impact approach. And we began teaching collective impact right across the United States with FSG, which was the group that wrote the original paper, and of course, right across Canada. And to this day, it's still an extremely popular methodology with tremendous outcomes. Here are the 5 elements that they observed. I'm just going to be a few more minutes, and then we're going to move into questions. First of all, it's about gathering a diverse group of people together. We often say government, business, voluntary sector, and people with lived and living experience. And that's broadly defined. Universities are often put under government in this case. And to have them learn together, usually for a year, sometimes 18 months, to think together, to let go of the way that they currently think about the issue, and try to come up with a common understanding and a common agreement from diverse perspectives about the issue, and then to have a shared vision for the future and eventually a strategy. This is what we call a common agenda. And it means that hundreds of people and agencies are in agreement about what we should be doing together. Extremely important here. A sister to the common agenda is really diving deeply into the data. What's the data and how do we understand it around this issue? In the case of Waterloo, what's the data around health? What's the data around health in Waterloo? What's the data around health at the University of Waterloo? How does it compare to Wilfrid Laurier? Is it a contextual thing, or are we both pretty much at the same place, Conestoga College? How does it start how does it compare to others in Canada? Again, contextual. And how does it relate to around the world? But eventually, once we understand the data, we begin to understand what are those data pieces that are most important to us to understand, and that we think, okay, if that changes, right? If that changes, let's say, one of them might be the amount that people walk. I'm not saying it is, but let's just use that as an example. And then we start to track. How often do you walk every day? How far do you walk every day? Right? Sometimes it's these, you know, base ideas that can be the most important in terms of health outcomes, because if you walk a lot, you may be doing a lot of other things. I'm not saying that is, but we start to come to an agreement about what it is that we're tracking and measuring, and that everyone in the system is getting that information and responding to it and having conversations about it. This leads us to what we call mutually reinforcing activities. So when we put a strategy together, we're looking for the kind of strategies that have a collective response. So it's a kind of a strategy where business, government, community, and people with lived experience all have a role to play. So let's say healthy eating is one of our strategic directions, right? And we're wanting to help students eat well. Well, what's the role of business here? Well, healthier offerings, um, making it easier for people to not choose French fries. Just saying, right? Um, what's the government role in terms of policies and funding, right? So when it comes to healthy eating, what's the government's role around food security? What's around urban planning in terms of the ease of finding healthy food is another one. What's the role of the community agencies? Well, there's many different agencies that care about healthy eating, that care about food security, and they would be involved. And then what's the role of the individual that is engaged, let's say the university student, the faculty, the staff? Well, it's about making healthy choices when it comes to eating. So what we do is we start to then say, okay, well, if everyone needs to be engaged here, when we come up with a strategy, um, how do we come up with the kind of a strategy where everyone has a role to play? All the sectors have a role to play. That's somehow unique in all of this, and we talk about that some more in the question period. Continuous communication is a big deal because when you have that many players at bay, we're continuously finding different and creative ways to share our stories, to share our learnings, to share our impacts. And lastly, when you have that vast number of groups involved, we need a backbone structure. And we're building that now, a staff that is allowing all of these different sectors to grow together, to keep them engaged, to drive initiative forwards. We'll have a whole series of working groups, and those working groups will all be supported by staff. So that's essentially it, that is collective impact. And, we often ask, we were asking the question early on, is this the best change methodology? There are many of them. Collective impact isn't the only one. But it's particularly good when we're wanting to aim for population level outcomes. We want to change the needle here. We want to get better. It's not that we want to just keep things the way that they are. This is a long-term process. I mean, we're going to develop a 5-year plan. I think that eventually we'll have completed a 20-year plan. It requires everyone. The university itself cannot do this for its students and faculty and staff. Everyone in the community needs to be involved, and everyone across the university and every faculty needs to be involved. And of course, I'm hoping, and it's so far, there's no one that's saying we shouldn't. We need to use measurable data to set the agenda and improve over time. And yes, there's broad commitment to community members and leaders being involved and working together around this. Lots more that I could talk about here. Let's move into the question period. Sorry, I'm a few minutes over.
Thank you very much, Paul. Pardon?
No, go ahead. Sorry.
Thank you. Steve, did you have something you wanted to jump in and say?
Nope. Happy for questions.
Awesome. So as I mentioned at the beginning, along your top menu there's a Q&A section. If you have any questions, please pop them in the chat. First one, Steve, could you speak a little bit about who the formation team consists of and how that group was established?
Yeah, good question. So as Paul mentioned, the goal, I think, is to try to engage a broad community. So Paul mentioned, folks with lived experience, which includes staff, students, and faculty here on campus. Turns out we know a lot of those people. There's 40,000 of us, so hard choosing individuals there. Also looking for folks in the community. So whether it's business leaders, so I think Paul has challenged us to think quite broadly about this, but thinking of folks like developers that are building the homes that our students live in some cases. So we're still, in that sense, growing the formation team a little bit to include some of those groups. Specifically, we do have a number of folks that are on the formation team. I'm happy. I don't have the list of names in front of me here. Donna is one, but we have a host of folks that are ranging across some different faculties, student services groups, academic support units across the university. We're continuing to try to attract more folks from the community in terms of business leaders, municipal government leaders, etc., to continue to round out that team.
Very much. All right, I'm going to read our next one. Rec and Leisure is a recognized leader in equity, health, and systemic change and social innovations that are politically informed. Why is it that we've only been in touch in an informative sense and not a consultative way? It also appears that we're sidestepping the elephant in the room, embodying equity and accessibility, which include number one, staff wellness, in precarity, economic restraints, and number two, the exodus of faculty due to lack of social and mental health support, and three, the inclusion of non-liberal performatives in change making. Where is the funding and focus of this initiative originating, given the economic climate on campus? How do we begin this conversation despite a crumbling foundation of staff and faculty support in essential areas of working well on campus? So massive question with a few components in there. Would either of you like to start chipping away at some of the pieces?
Well, thanks
it is
so much,
in the chat
Kimberly.
for reference.
Yeah, thanks, Kimberly, so much for, I think those are like 7 questions, right? And they're all excellent. First of all, of course, we're just at the early days, so we so want to, and we do have people from recreation and leisure on the formation team, but we're in very early days right now. So if you haven't been consulted, you will be, and not only just a little bit, a lot. And yeah, I know there are issues, and we're trying to understand them, and you have them outlined here. What's really important for us is not just what's happening, but we want to understand the data about what's happening, right? So it's more than anecdotal. We want to really understand, because with numbers we can bring a case forward to say this is what's happening. And I would love for some of those people who are leaving the university, I would love to interview them, or if I'm not even sure we'd be able to get their names, but if they would come forward to understand what's happening. Nobody wants staff to be unhappy. Nobody wants students to be unhealthy. We want all of them to be a big part of this amazing community known as the University of Waterloo. The question is, how do we do it? And how do we all work together toward finding the proper solutions? By the way, you're looking at where does the funding come from? Right now, it's all from donors and other donors that are lining up. So I think other than some staff time, Steve, if am I right? We're not using any university money specifically for this program.
Correct. It's all through philanthropy and the support of our donors that are passionate about, I think, trying to affect widespread change in health as well.
Thank you for that, Paul.
So Kimberly,
Steve,
I'm really looking forward to chatting with you. This is an amazing question.
Steve, did you have anything you wanted to add there?
Just a brief response. I think Paul, hit the nail on the head here, and the elephant in the room, obviously. I think what our goal is, like, how do you eat an elephant one bite at a time, I suppose. These are the conversations we need to have right now. we need to understand more, and I think Paul did a good job of capturing this. Well, first, like, let's look at some of the data. And then why is the data coming out the way it is? And can we have conversations around, some of the issues that are arising and, eat that, I know this is kind of easy to say, but let's eat that elephant one bite at a time, right? Like, let's start having these conversations and understanding what are to Paul's point earlier, what are the power dynamics that shape this? What are the policies that shape this? What are the systems that are impacting the outcomes that we're having? There will be challenging conversations, but I think in part through Healthy Waterloo, we're trying to create opportunities to have those conversations, to learn, and to hopefully design a system that's better aligned to making sure it's good for all of our health to work and study at Waterloo.
If I can add my own 2 cents in on this too, some of the early day conversations, in touching on the point of how are we beginning this conversation despite the climate of the university at this time, and the conversations around, well, like, this is a great time to start it, and support the systems and the people that are here now, and have them come together. Like, waiting, I think, would be a detriment. But that's, yeah, early conversations. Are there any other questions? Anyone welcome to raise your hand and flip on your video too, so it's not just our faces on the screen.
Donna, Owen Babcock just gave us one.
Oh, perfect. Thank you, Owen. Okay, so is the initial focus to be on the UW community and hope that spreads widespread to Waterloo? Wondering what the scope of Waterloo is.
Can I take a jump at it, Steve?
Yeah.
Like, Owen, this is like so dead on, and I wish you were there because you'd be more on my side here, right? Because it's like, okay, 30,000 of our students live in Waterloo. Most of our faculty and staff live in Waterloo region, not all, but Waterloo region and beyond. So how can we be the healthiest campus if we're not the healthiest community? This is really the question that I'm asking. And I was meeting with the mayor, and she'll be okay with me chatting about this just last week about this. And I was just asking, like, if you're kind of thinking about the park, Waterloo Park, are you thinking about how it affects, like, how it could be student friendly, right? Or University of Waterloo friendly, or Wilfrid Laurier friendly, or just, resident friendly? And what does it mean to be resident? And what does it mean to, be at the University of Waterloo? Because it's kind of a dominant, large pocket of people on either side of the park. And why are they not using it more? This was my question. And of course, the answer is, well, are you sure they're not using it a lot? I see them there, and I go, I'm not sure, but we need to understand, right, what's happening. We need to think about all of the food choices that are around the university that student and faculty and staff are using. And is it easy to make the right healthy choice, right? How walkable are we? And maybe we should have put the LRT 3 or 4 blocks further away so that we have to walk a little further. And maybe that would be a health initiative. I don't know. But ultimately, we don't even fully understand how, if we just think of students alone, how they are using Waterloo community services, whatever they might be, private sector, public sector, community sector, how they're using those, and how often, and in what ways, and how important are they to people's health. I have a feeling they're very important.
All right, I have one more to wrap us up. From Sanjay, this has been a great presentation. Thank you for sharing. There is great detail into the development of a framework towards making Waterloo healthier, which seeks towards developing continuous change. I wonder, what are the problems? What spurred this team into action?
Over to you, Steve.
Yeah, good question, Sanjay. A lot of the conversation again, as I mentioned earlier, kind of originated out of the Waterloo at 100 and thinking about our values of thinking differently and kind of challenging us to think about this. And, one of the things that kept coming up in conversations, obviously, is health. And I think this ties back to some of Kimberly's comments about, the sentiment on campus and economic times are changing. And there's a host of kind of items bubbling up. And through those conversations, I think there was an identification, and we already know this, that health has become what you might define as a hard fact problem. Like, how many of us perhaps had conversations over the long weekend with family and we started talking about health and like, man, the health system's just not what we want to be. We hear in the media, the health system isn't, hospitals are full, there's waiting times, there's all these things. What are we doing about it? And are we doing something like, are we, to Paul's point, are we thinking about the problem in the right way? Are we trying to move the needle? And, individually as individual researchers, we're all trying to do things to move that needle. But collectively, what are we doing together? I think of Donna in athletics, and how am I collaborating with Donna in athletics to understand the nuance of the unique health challenges and how we're trying to move that needle forward? And then to Paul's point, and this is to Owen's comment, man, we're situated in the community of Waterloo, so the lines are pretty gray, or pretty blurred, I should say, between a healthy campus and a healthy community. It's not a sharp cliff there. So now, the problem extends to, well, one problem is, how do we even understand where the systems link? How are our staff, faculty, and students leveraging the community resources in addition to what we have on campus as well? So I've kind of skirted your question a little bit, Sanjay, but I think part of this is we need to have a broader lens to understand all the nuance of the problem or problems around health. But Paul, I'd love to hear your thoughts as well.
Steve, you did a great job on that. I have nothing more to add. It's exactly there. And Sanjay, again, would love to hear more from you and what you're thinking about this. I think over to you, Donna. I think we're coming right down to the end of our time, huh?
I think we nailed it in terms of timing. So I would officially like to thank Paul and Steve for sharing their insights with us. And to everyone who attended today, please keep an eye out for future Healthy Waterloo Initiative updates, as well as webinar opportunities and opportunities to get involved in the consultation process, because there will be a lot of them. So if you have any questions, please reach out to any of us. Steve mentioned it was healthy.waterloo@uwaterloo.ca. Did I get that right?
Correct.
Send an email that way. And thank you all for spending an hour with us.
Thanks, everyone. And Donna, thanks for moderating. Appreciate it.
My pleasure. Take care,
Thanks,
everybody.
Bye-bye.